And we are live. Hello,
Hello.
Mr. No, how are you?
I'm fine. Thank you so much for this invitation.
And hello, Dana. Nice to meet you online this time. I see that we have our first people that are joining the webinar. Julian, bună seara tuturor. Bună seara, Julian. We'll be speaking in English. Bună seara, Mihaela. Hello, Florin. Hello, Ileana. Hello, Lavinia. Nice to see you. Dennis, you have sent the message in private, but I can tell you bună seara. Ludwig. Okay, so we are 100 people live at this moment. More than 500 medical stomatologists joining this and registering for this webinar. We are so thrilled to be seeing such a big enthusiasm of what we'll be speaking tonight. Mr. Paolo showed us his slides, and there are top-notch in technology and in stomatology. Hello, Dana. Hello, Reka. Please, because I know that we have quite an international audience at this time, can you please send in the chat the city and the country that you are joining this webinar? We are pretty curious to know that. If you are joining from Romania, we know that 60% of you are joining from Romania, but we have seen people from Bulgaria, Hungary, Poland, and many other cities and countries.
The receiver to avoid losing it.
Okay, so Slovenia, Miha, nice to meet you. And the city, please. Cluj-Napoca, Romania, Florentina, Tirana, Albania. Hey, nice to meet you, Alcheta. Galați, Ploiești in Romania, Barcelona. Great. How is the weather in Barcelona, Leski? I think you are making us a little bit jealous. Bulgaria, Copenhagen, Denmark, Târgu Jiu, good evening, Focșani, Hungary, Republic of Moldova, Brașov, Budapest. Okay, quite an international audience. We are very happy to see a very big interest in this webinar and in the clones method. Great. So let's begin, because we have lots and lots of things to cover tonight, and I'll share my slides in the beginning. As you may know, we are speaking about dental prosthetics, and mainly with the clones method, with our invitee tonight, Mr. and Master Paolo Cano. We'll be spending around 120 minutes, including your questions. I know, and probably you have a lot of questions and you want to get the most of the time that we have it together, and I'll invite you to put your questions on the paper and take full advantage of the minutes we have at the end of this webinar and ask as many and as relevant questions to Mr. Paolo Cano. Who is Pasindora? As you may know, the main organizer for this event is Pasindora. Pasindora is a dental clinic in Râmnicu Vâlcea, one of the top dental clinics in Vâlcea, and I may say in Romania. And because of Pasindora is fully invested, and Dana, who is the owner of Pasindora, Dana Diacono, nice to have you here, Dana. If you can put or speak one or two words, that would be very pleasing.
I'm very excited for this moment, and I think is the most important to learn from the master.
Great. Dana had the great vision in order to go to Mr. Paolo Cano workshop, but not in Romania, not in Europe, but in Brazil. She went with full cost to Brazil. She loved the workshop, and because of that, she invited Mr. Cano in Romania to have the workshop for Pasindora specialists, and not only, also for other specialists in Romania and in Europe. If you may ask, who am I? I'm Paul. the name with Paul and Paulo is just a coincidence. I'm from the marketing team of Pasindora, and I'll be the moderator for this webinar in order to put in light people that have great knowledge in terms of dental and stomatology. Our speaker tonight is Paulo Cano. He has over 40 years of experience in dental and collaboration with top international clinics, is the creator of the clones method, and we can understand the method from the creator, a pioneer in aesthetic digital prosthetics, professor, author, and mentor to thousands of clinicians, renowned for his exceptional natural aesthetics and his restorations, and an expert in CAD and CAM integration, clinical photography, and minimally invasive techniques. Mr. Cano, such a pleasure to have you here, and can't wait to see what you've prepared.
Thank you so much for this opportunity to be here in this virtual conversation. It's a very pleasant for me to have once more with Dana. We met first time, I think in Romania, and then right now after in Brazil, I think 2 times. And then I went to Pasindora Clinic. It was wonderful clinic, beautiful, like you can see in the picture in the she's place is so beautiful. It's amazing. I think it's never seen such a beautiful place for working, and I was very honored to work in her clinic. It was wonderful for me. Thank you so much once more to have you stay here to working together with Dana.
Thank you for accepting our invitation.
Thank you. And
let's start. I think people are eager to see the info, the method, the process.
Okay. I want to just tell about my experience. My experience is more clinical experience, not so like a research. I did a lot of research since I was very young for many doctors here in Brazil, and after this I wrote some article about some restoration, like photocuring restoration or direct restoration. And then after this, I working with the digital, but my mainly job is prosto. I did some master of implant, but my job is more in the prosto field, included the dental gingival or some implant prosto. And I want to show. I think so. I need to start and then go to share here and okay. I want to talk about the digital workflow, because this is the era of this way to work in the dentistry, and then I want to just create sharing some concept, because the most difficult problem is the concept, or to create mindset about this new way to work, because this is like a start very fast, and then we have no time for growing like to hybrid solution, and then go to understand very well the digital workflow. That's why I prepare just for create some concept, just for change some mindset, okay? And then the digital workflow for me is the best job, the best way to work in my job, because it's more easy, more predictable, and then we can create the owner solution, because we can see everything simulated, everything during the preparation, not just when I start our job. Before procedure, any procedure, you can simulate it, and I can understand very well the patient.
Mr. Kano, I think people are not seeing it anymore. Can you please stop the share for a moment and then share it again?
But the screen, yeah, or the presentation.
Neither. At this moment, neither. Can you just stop
Okay.
the share for one moment? Yeah, right now it's perfect. You rejoined. Can you please share it again to see if it's okay at this moment? Yeah, it's shared. Right now we see it. Perfect.
Okay.
Right now we see it. Thank you.
And then just for talk about my timeline about digital, I start in 2010, first of all, when they launched the blue scan. Was wonderful this time, because they developed not just a blue scan, but they had some MXCL machine to mini machine, and then after this they create a very good software to imitate nature morphology. That's why I could create my library, my crown without any handmade morphology. That's why I put the name like a skin, because skin means like a shell, and then I could apply this shell from the molar or anterior, and that the I for this concept I designed my restoration, and then I start from this. And after this, I went to US in 2012, and then they invite me to show my technique, but the normal technique, not a handmade technique, because was for me that time the most wonderful to understand, to create my my job was the handmade morphology, handmade ceramics was wonderful. I included wrote my book about morphology, and I stopped. I created just for procedure, but I stopped for anterior, because I discovered digital way, and then that's why I could not finish my anterior library for morphology. And then I start the people at that time. John Ferenczi said for me to change the name for to anatomical shell technique, AST. But AST look at not so like the word from dentistry, and then I change to skin, and then I just create a Y here, and then I using for many years this, and then right now I put clones with 2 double L, like genetic or genis, and then we create this because we can imitate or create some mimic from the nature. That's why I put the clone's name, okay? But many people ask me, how can I start in digital? Because digital looks not so easy to understand. It's very complicated to understand the software, and then many people afraid for starting in digital. I can say just you need just information and practice, and you have to create some habit. Just this. no, not more. And then you go to digital very fast. I saw many people after change some mindset, and then they could start, and then they could start with digital very fast and had some successful in this way. Young people, they can start like without nothing, because they have no difficult for understand the digital. But I can say that you cannot say different dentistry, because dentistry is only one. Having no like a digital dentistry or digital or traditional dentistry, because traditional or digital dentists working for carrying on or care the patient, the oral health or for doing your job for reaching the very good oral health. That's why digital means just you can implement or you can work with digital tools, or you can work with the traditional way like many people have. And just for understand very well which means digital and manual, because we cannot say like an analog dentist or digital dentist, because digital doesn't mean, or analog doesn't mean human being. We are not a machine. We are not a software. We're not a processor. And then we have to understand that the dentist they work with patient. And then if some people using manual equipment or manual or analog equipment, we can say this is like a you have a normal and traditional dentistry. Okay, just for understand, I create some analog situation for understand. For the manual means you have to touch this lock to open the door. If you not, they cannot screw it, or they're not rotate it, and then you cannot open the door. This means manual. But if you have some electrical button here, and then if you just press this lock can rotate. This can work it without any touching, like, and then we can say this is an electromechanical lock. And then you can put this button for them in your office, not in the just in the in the door, but you can put one electrical wire, and then you can put anywhere where you want. And then this means electromechanical locker, but it's not digital. Digital means processor, like this. Processor means you can press, you can put password, you can from another country sharing the code, and then they can without anything. Or if you can touch this locker, and then they can open the door. But usually digital means processor. There's a binary logic processor information, and you have more in the, for example, in our situation right now, we have in the computer, in the phone, in the iPad, and then everything right now, or many device is using processor. This means digital. That's for understand this, we can say we are dentists, dentists like an operator or dental technician. We continue stay just taking care for the patient using normal equipment or analog equipment or electromechanical equipment or some analog instrument or like that. And then this means traditional, because if you start working with hardware or software and then you stay using digital tools, and I prefer working with digital tools because they help us more than normal equipment. That's why I can say digital means tools in dentistry. And then if I understand this, I can say in dentistry, you can create or you can see one big ecosystem, not just create some smile design, not just create some mock-up or some for digital design for show the patient, but you can building everything for the beginning, for the starting with create some data for sharing this data for any profession, like a technician, or create some like a multidisciplinary situation. The first time in our job, because many people said about this, we have multidisciplinary situation in my job, my clinic, but it's not true, because multidisciplinary situation you have just with digital, because you can share without any conversation, like you can do this conversation digitally or in any country, any place, different place, not just individually or in front of the person, the people. And then but because dentistry is so difficult to work, because you have any different situation, you have no equal caries in the mouth, no equal periodontal problem in the mouth, and that's why the step-by-step process is so difficult. And then having no shortcuts, because many people want to do shortcut using digital way. You have the guide, you have all the situation they can show it for you, all the precisely way, but it's not shortcut, because you have to create a diagnosis, you have to understand very well about this. That's why it's so important. The people know that digital doesn't mean shortcut. And another thing is the digital, traditional or digital doesn't mean successful or quality, because depend of the person, depend of the case, depend of the profession or professional, or and then all this is important for to create like a success. The quality means you have to understand very well everything about dentistry, and then you have a quality, you can treat very well your patient. But like I said, the digital, you have a simulation, is making difference, and then you can work very well in your job more than a traditional way. And another thing is you have to all the time thinking about the future. Future means all the time will change. we stay in the era, and when you have everything, every minute stay one person change something, and then we have no stop to go to and shifting our job, and then go to up, or to create, or to replicate, to understand new ideas. Every time we have to update our mind. This is very important to understand. And I know we are in the fourth industrial revolution. Some people will lose your job. Some people will start. But the difference is information, like I said, and habit. How can I do this? Information means every day I need to create some habit to take new information always. And because we stay in already incorporating digital technology, automation, and right now artificial intelligence in our job. That's why always we will have this new idea, like growing everywhere. Okay, and then we have to understand that artificial intelligence create new situation every day, because after they start working, or we start working, or when they develop and some just because I stay in Brazil, and then and then I just need to and then some people create artificial intelligence, and then I need to understand where the AI stay working in our job. The first of all, just for understand that the artificial intelligence is not so difficult, because they will help everything for us. For example, I created my first draw like that. I was very happy because it was so easy to do, and then in few minutes I create like that, and I become more happy because it looks more beautiful. And then I put some difference in the prompt, because I could understand the prompt. How can the prompt work it? And then I start creating like in the prompt, not seeing or telling the artificial or writing like I want to draw some girl or like that. I put like photos, but I put the name of photography, and I put the lens, I put the camera together with the prompt, and then the AI could understand that my photo is not normal. They can like a Google, like a search or go to searching this photographer, and then take this idea, and then could create this image for me. And then I could understand very well that in one day, just in one day, I start from like a draw, and then I could create like a photos, and then we can say AI just help us for create everything more easy to do, easy to have our job. This is like a photos, but I can create like one video and environment, and then I can create shadow, light, everything, expression, everything, emotion like that, like one girl, like a sadness girls, but I can put one cat together, and then she can, I put like one life, virtual life for her, and then this is the AI business. This is the AI tools that we are right now in narrow AI. Narrow AI means without any consciousness, and this is like a transformer LLM AI. That's why I can use like assistant, but without any conscience. And then this is the way to we can work very like a complex situation, just using this. But AGI, like a general AI, this is like we have to create another structure, and then this AI can or can have capable to understand and have a cognitive ability. Maybe in 2 or 3 or 4 or 5 years, we have this kind of AI. General AI means artificial general intelligence. This means the cognitive. You can talk with them like a human being, and then they can memorize, but they can have some ideas, and then they can work with you like a human being. Okay, but this is the super intelligence AI. This is stay with just it's not possible until now, just a theory, and maybe we have many years to create this super intelligence AI. Okay, this is not easy to build in this. Okay, but why I stay talking about this, because we have already in our job AI since they start in 2000, and then especially in 2010 they create the biogeneric copy, but they put just in 2009, and I received this software in 2010. This software was so wonderful, and then I can say this rack I start before, but they launched here in Brazil for me in 2010. But in that time, I could not believe that this was artificial intelligence, because they just create some algorithm, and then this algorithm just meshing some value, some file, and then they create some like an intelligence. But I can say that they create like a they start with algorithm, but they create in one artificial intelligence, and then after this, every year they stay creating new version of artificial intelligence in any software that I stay using right now. And then this not like in the future, but this you have right now, just for intraoral scan, or the software for the CAD, or the like for example for create a design like a Smile design, and for Incofar with the Smile Cloud, and then everything right now you can use AI included in your iPhone or in your WhatsApp, and then everything you stay using AI together in your life right now. That's why we can feeling very well, happy to using this, not like afraid for using this. And then you have everything more automatically, and then you can spend your time for working in another job or for building your skill, and then take some beautiful photos, and then you have more time and your quality of life become more high level. I think this is the way for the future for us. And we have some goal that I need to talk about, because the people want to see like a fantasy in the digital dentistry, because I have to understand right again, the shortcut doesn't exist, because we as a human being working in the complex situation for understand more, and then we as a human being stay creating complex situation. Okay, that's why digital or artificial intelligence work more in create more complex situation, not create such shortcuts. Okay, and then we have problem. We are as a human being stay create something different, something new ideas, and then new color, new car, new building, new architecture, new decoration, everything we stay always creating different. And then that's why the artificial intelligence need to work with us for understand what I need to do, what I need to feeling, what I need to create. Okay, and and then in our job, for example, if I want to use AI or digital workflow, I need to work in, for example, a different way to create a different protocol, because we need to understand that every procedure need to create different protocol. This is another thing that I need to understand. You have many people afraid for, I have this protocol and then I have everything like a recipe. It's not true. For example, in the endo, we have able to right now to put the machine, electromechanical machine, but with measurement, real measurement for the root canal. This machine is digital, the processor working with us to understand where is the electricity working, and then go more slowly, and then start to create some different sorry for the, but just translating my Portuguese. and then we have right now in every procedure need to create new protocol, and then that's why for a restoration, like a cosmetic restoration, I have to use a different file and different protocol. Okay, and then I would just talk about my my field, like a restoration or cosmetic restoration and then I need photos, scan, or face scan or intraoral scan, or if I don't have intraoral scan, I can use impression, normal impression, and CBCT is very important, and videos. All this, I need to understand that all this is different technology, and then I have to superpose in one CAD all this different technology, have to create one head of the patient head to understand very well, to create a very good diagnosis and create our planning, and then I can start our procedure. Okay, and then for understand, I have, for example, one clinical case, but before I need to understand that for create aesthetic restoration, you have to create harmony with facial analysis of facial situation. The aesthetic does just exist if you use facial photos or all the facial situation, because the facial photos, you can see the hair or the eyebrow or the eye or the nose, and then one element of face is tooth. But I need to see the tooth is not just stay alone, stay with lip, but the lip showing the problem of the harmony with the gum, and then all this situation means face. All this, the tooth means face. You cannot separate the face with a dentition. And then when you work with the dentition, you have to stay with the facial, the photo or the 3D scan of a patient. And then we can say it's impossible to say oral rehabilitation or static veneer without any facial reference. Because if I do without, it's just it's like a merely beautiful restoration, not aesthetic restoration. Aesthetic means facial reference. And then I have to create all this, take all this file to put inside the software, send it for example, for technician in the planning center, and we can using, for example, 3Shape or Exocad, and then I need to create all the step, our owner step, to understand how can I create the new smile design, not just create like a mock-up, but create everything since the beginning, for start patient until finish with cementation and occlusion treatment. Everything I can see in this computer, in this software. That's why it creates some difference. It's not re-engineering, because re-engineering means like one car, and then I can destroy this or explode this car, and then I can create another car, seeing the whole piece that to create this car. But in the dentistry, I cannot find any situation, equal situation. Any caries, any case is equal. And then it's not equal. And then we have no experience. You have no re-engineering. That's why it's very important to understand that the digital is very important for us, because this we can, with this software, I can create from the beginning until finish before our treatment. For example, we have some protocol. Here I use it just for photos, and the photos have to create with protocol very frontal view, and I prefer five photos. One is close lip, rest lip, smile lip, force smile lip, and the open smile lip. Okay, and then this is the 5 different photos, and then I have to create this like a protocol, and then we have frontal view, 45 degrees and 90 degrees. All this, it means protocol for the photos. And then I have a video, and then I can, to understand very well. Just a moment.
Shall I get into it, Mr. Paulo? I'll take advantage of this moment to see what questions, if you have any questions until this moment, or if you find something really useful or really relevant, please tell us in the chat. If you have any questions. Not a problem.
Can you hear me?
Yeah, I can hear you perfectly.
Yes,
so
because
we'll see if there are any questions, because I invited everybody that's participating. Yeah, it's perfect. You can continue, and if there are, I'll be joining.
Yeah, the facial reference means everything you want. For example, this is the classical reference. I just using right now just this vertical and horizontal line. This is, for me, the most important for us. Everything you have in the CAD system or CAD software, no worrying for that, and then this is very easy. But the more important to see the problem that the patient has. For example, here, when I put like this line, is different when I saw the patient clinically, okay? Clinically means just the patient comes to our office, and then I can say, oh, this is beautiful lip, beautiful eye, or she's the beautiful girl, and then like this, or seeing the just intraoral, I can see caries, I can see the missing tooth, and then everything. This is like a clinical situation for attend the patient. But I prefer right now, after I started working with my team 2 or 3 years ago, and then they do everything for me. They attend first session the patient. The patient sometimes they ask about me, but they said no. They Paulo prefer take all the file. This is the first session for the patient, and then they take everything, the art file, and superposing in the CAD system, CAD software, in the ExoCAD or dental system, and then I see in this file, and video. I have 2-3 types of video, and then I can right now understand the patient, the problem of the patient, because in the video they say which problem they feeling, and the photo can show me like a very stopped situation, or they do for me face scan, and then I can work with all the file for understand the patient. In the second session, I know everything for the patient. They can following all the step that I set for the patient, and then they always want to my treatment because I have no like just create mock-up just for showing the patient first of all, and then they accept my treatment. I think this is working very well, but not for the all patient. When you have, for example, first session just for taking all the file and put together in one software, and then you can understand or can analyze very well all the file, and then I can describe everything that the patient need. And then when in the second session, without any convincement for the patient, and just showing the problem for the patient, show the solution, show if they want to do without any orthodont treatment, or they have some financial problem. And then I have all the solution, and then the patient will accept very well. Because if not, everybody stay working with patient, just creating mock-up and then convincing patient, and then they cry. But they go to another dentist for make some secondary acceptation or opinion, and then this is not so good. When I know about everything, this is the most important for the patient, but because clinically I cannot see the patient, for example, if the patient have like a canty situation, or they need to do some surgery in the first day, this is not make sense, because I cannot see the endo. I have to take one X-ray, and then everything I need to understand very well. My opinion is not true. It's not like a superficial opinion. But the second session, when I show everything for the patient, and when I can understand better, when I see the photos, because of this, I can say, this is protocol. Protocol means everything of file that you need to see, and then you can put in your software, and that you understand all this file that you put together. And then I create my protocol because of this, and then because I can complete a whole process for understand the problem. If I cannot understand, I sharing this for my colleague, and then they can have some. If they can say for me, this is the solution, and then I can say for the patient, or you need to go to another professional or another specialist, and then they have some solution for you. And then we know everything for the patient. That's why it's very important. In this patient, we can see, for example, the lip in this side. In the left side, you can see more taller and more short. In the right side is more wider and more is not so is more smaller. And then you can see everything using photos. And if I put just midline equal this copied art or copied ball, and then we can sometime create some wrong situation, because in the rest lip I can see in the midline, face midline or facial midline is the same of teeth midline, okay? But I don't know if it's correct. That's why I need another photos, because right now I can see open bite or in the small smile, or and then I can see very like a canty situation of all the arch. And then I have one, for example, one very different situation when the patient stay in the conversation clinically. They never showed everything for you because they feeling not so good, and then the photo or the video can say for you better than clinical situation. Okay, and then we can right now seeing this, and then I will go to understand all the position of all the structure, the facial structure, and the intraoral structure. Okay, and the perioral structure is the same. I can see everything here without any touching in the patient, any conversation of patient, because I cannot say this. You have some people like torced nose or everything like that. Okay, or this is more open and this is more open lip, this is more closed lip, because it is equal for the patient. Okay, but it's not real situation. It's not good situation for the patient. But why we have this kind of discrepancy the dentists create? Because maybe they create just analog analysis of patient, and then I prefer more and once more to do everything digitally. Okay, because digitally this is my presentation is a keynote. Okay, but everything I can do in the compute, in the software, in the exocad or dental system. And then I can see, for example, right now, the discrepancy of lip, okay? And I put all this reference in the bipupillar line, because I want to create this line or alignment of teeth alignments equal this bipupillar line. That's my goal in this patient, okay? Not a perfect position, because reference doesn't mean rules. A reference means when you have, for example, one blue building, very taller building, and then you say, oh, you can see this building, and then go to more two store, and then you can find, for example, one store that they want to go. And then a reference means the something that you can use as to go to your goal, and then this is the reference. Okay, it doesn't mean rules. Okay, and then I can see the commissure is straight, very parallel with a bipupillar line. If I imagine one line here in the nose line is the same. Okay, just a moment, maybe what? Just a moment. I sorry for that. You can hear me? Can you hear me?
Yes, we can hear you very well.
Okay, sorry for that, because
we could also hear that you are a very requested doctor, and you have calls at this moment, but it's not a problem. We are listening to you.
Ah, okay. sorry. And then I have, for example, to understand we have three of curvature. One is edge curvature or borderline, the teeth borderline. Another is papilla line, and another is cervical line or zenith. And then we have to understand that this is our goal, our reference, okay? But sometimes I have to use another kind, the line that I can see in our software, okay? And then how can I create good situation here, the solution of this case? But first of all, I need to understand the problem of a triangle. I have a different triangle here. If I put this line here, okay, I can see less triangle here and very wide triangle here. But I stay seeing not in the edge, but I have to see the papilla or the limit of tooth, and then from this I can analyze my job, okay? And then the real triangle is this size. This size means I have here the contour of gingiva, but I have in this teeth position or this contour, like I don't know how much millimeter I have here. And then I have to analyze this in the software. Software is, I can see not like a normal rules, but I can see like a very accurate position of this, okay? And then we go to understand how can I create this contour, okay? Because for create this contour means two things. One is the papilla. When I cut this, I stay creating the more biggest papilla. But I can, but the truly is not. It's not true. I stay doing just cutting gingiva, okay, or gingivectomy, because the papilla remain the same. That's why I cannot touch here, okay. And then if I just increase just the papilla or the contour of this tooth, I can say stay in the 50% of the length of this crown, okay? If I go here, okay, I have to create a little bit or the edge here, because here I'm missing here because of the curvature is wrong curvature, and then I have to increase edge here, but nothing here, okay? If I want to create both sides, increasing both sides means the papilla become more shorter. And then I have to decide this, because this is very important for understand that our job is create solution for the patient, the aesthetic solution. And then before they decide this, I have to see the photos or video. If she has some or showing all the time biggest edge of teeth, I cannot increase the edge of teeth, okay? I have to decrease or remain or maintain the same. And then this decision means all the file that we create previously, and then I can decide better. I can show the patient why I did this decision, and then they will believe me more because I study everything for the patient. I analyze everything. And then, for example, if I put 40, just 40 right now, and right now, because I increase here, the total amount right now is smaller than before. And then, then I can place one tooth here over this tooth, and I can see if it's working very well or not, this is aesthetic or not. And then the decision always is here in the software, okay? And then, for example, if I design, okay, something, for example, to do some procedure, like here, for example, if I just want to touch this frenum, cutting in the succular surgery is not so good, because if you touch here, you will cut the muscle. If you cut the muscle, the patient, they will move different way for the lip. The patient have to use very well the lip. That's why I cannot cut in the sulcus or in this lip sulcus and then just put in this position. I have to put one like a tunnel under the periosteum until here, and then push everything or pull everything in this side without any cutting muscle, because this is lip. Lip you cannot touch in the muscle, because if the patient start to create deformation in the lip because you cut all the fiber of muscle is not correct, okay? All this I can analyze for the patient, and then we can create everything for the patient, okay? I can see a perfection, I can see the level of bone, everything together, because I have the photos and all the file, okay? But why she has this problem? And then this dentist create one sulcus, like create an effect, like a vertical effect or axial effect with create one sulcus. It's not true. And then I decide, and then because the problem was the patient has talked with me. They said they just take what the impression and send for technician, and the technician put in this occlusal plan. Means very, very good occlusion plan, okay? And then, but the problems, the reality is, it's not this is not correct occlusion. This is the reality, okay? But I can see this in the photos, in the tomography, in the CBCT, and then I can, right now, some CBCT, you can see the skin, muscle, or teeth, everything, all the skeletal part. We have different kind of tomography or CBCT, but this we can see everything, okay, included ear and or separated tooth. If she did some orthodont treatment, everything you can see using this software, okay? But if you want using another software, you can see included sinus situation. If the sinus is like a opaque or X-ray opacity, or you can see transparencies, and then you can see everything, bone projection, or all the structure, like a surface of face, everything included ATM or TMJ, okay? You can see everything if you want to study this, and then you can see separated element, and this is like a unbelievable, working very well for us, okay? I put a very transparent, but I can put just the skeletal part, very opaque, and then I can measure TMJ or the muscle, everything here. in this file. It's the same file as CBCT and then different software. And then I can see, like, this is Dolphin, okay? Because this comes directly from the machine, and then you can see everything here, okay? But another, this is a blue sky, and in the blue sky, you can see right here, I could not understand what happened here because it stays separated. But in the video, I could see that stay like a cemented, and then I very curious for understand what happened here, and then but I can see everything here, okay? Every treatment, if the patient did some orthodont treatment or have some recession, you can see recession, you can see here the recession, you can see the apical problem, everything you can see here, more than just clinical analysis, okay? And then when I send for technician, every file, and then they can create one, for me, one alignment, and then they create one meeting for me. This meeting, like we stay doing right now, like a webinar, and then they show it for me his screen, and then I can say, oh, I don't like this morphology, I don't like this alignment, I want to put more to down, this more up, lateral. I can say everything for the technician, because we as dentists, we know much more about diagnosis, planning. We study about this, okay? Not the technician. The technician doing like a diagnosis WhatsApp. How can create diagnosis WhatsApp if a technician never study about diagnosis? Just in our university, they teaching about this, and then we need to understand that the WhatsApp doesn't mean nothing, because we have to say for the technician want to do this morphology, but I love this, but I want to see the level of bone, everything together. I have to create our job, our restoration, or our alignment, or our planning. I know that we have automatically right now application that they can create for you alignment, but I need to align based on diagnosis, based on problem of the patient. That's why sometimes we can design from some application, but finally the design will be different. The outcome is different. It's not like and then for create the same or the good outcome, you have to understand the diagnosis first of all, because you are a dentist, not like just design or for decoration. But if you do study about decoration, this decoration using functionality, your taste, your feeling, everything, more than just put some decoration color. That's why this is means our job. Our job is diagnosis, analysis, planning, choice, and decision. You can decide for three different designs for the patient choose, and then they can choose one, and then you can do this case that they wanted, and then have more successful than just create just expectation, okay? And then all the step for the digital and whole step, you can create guide. You can create guide for the mockup, you can create guide for the just for analysis, you can create guide for simulation, for the just for the final simulation, the or just for make sure if you good stay good in a good way, and all this step you have you can create like a simulation. You can create guide and included for the surgical guide, everything for the preparation, everything. That's why in the digital way, the ecosystem, you will see like a unbelievable infinite, like an infinite, and then you have to choose what kind the protocol you want to do to reach this goal. And then I prefer using this kind of anatomical, because if not, I create like here. If I put just round, I sometimes many dentists contact me because they lost this papilla, all the papilla, because they cut here and here because they want to put rounded without any situation of anatomical. That's why I prefer anatomical, because anatomical means you can see your simulation, and then you understand better the content of gingiva. The content of gingiva doesn't mean equal, because sometimes I want to do, for example, in diastema, you have a different situation of midline, and then the crown lengthening will be different. The surgery will be different. If you want to do equal one tooth, another tooth, this means all the patient has beautiful alignment, a good color, and then, but in this situation, yes, maybe the guiding can create equal design of gingiva, of preparation, everything equal. But doesn't mean true for the patient, most of the patient. Most of the patient, you have to correct, but correction doesn't mean just like many people doing just gingivectomy, okay? This gingivectomy means just cutting bone, but you can see here the junction fiber, and then you have to create the immediate you have to create the biological width here, okay? And then you have to take care for just gingivectomy, okay? And the bone correction or bone osteotomy is very important. For example, if you cut here, just with electrical surgery, but here is the junctional epithelium. If you put this two out, because free gingival of the sulcus is separated, they protect the connective tissue and junction, and included bone or periodontal ligament. Everything they stay protecting, because they create one socket for protect. If you just touching this without any biological width, you have problem. Here I can say immediate biological width just for the biologically or physiologically, they can create this biological weight. Just cutting is not so good. And then I use piezoelectric flapless, because piezoelectric is more predictable, because I can take off the bone, because the bone with 4,000 vibration, the bone go very fast. And then you can touch with piezo and then go very fast, create some contour, like a 3 millimeter from this, from the gingivectomy, 3 millimeter more inside, and we can create bone contour equal gingivectomy. Makes more sense than, and protect more patient. And then after this, in this case, I needed touching many tooth, because all the tooth was in 3 years, because she started 3 years before with another dentist, and then I saw a lot of caries, a lot of problem here, broken provision, and what was ceramics here, and then the post, and I did again, because this doesn't mean, I think for me it was just they use it the same, maybe more than 10 years. She said for me they did one endo, and then maybe this time they created this, and then right now I did again, and then using just same morphology, because one thinks about digital, another thing about the digital is they can imitate, create some replica from the nature. The morphology or teeth morphology you can bring for you. We can bring in the software, and then you can use this. That's why I prefer working with non-touching anatomy. Just create some stain technique. We can say magic makeup, and then we can create all this old people, old teeth, or young people, or middle age people, and then I can create everything different.
I think all this there'll be in so much depth in the February workshop, Mr. Cano, going to the magic makeup and also the clones method.
Yeah, because this is like I want to show that the digital doesn't mean just mock-up and then just convince patient. All these step means our dental field, because many people right now, many young people here in Brazil, I don't know in Europe, but in here they just following the smile design, and then they don't know about nothing after this, after operative dentistry. Like they don't know about every step to do, like a preparation, like everything, like a staining technique for finish the case, occlusion. They don't know about this. They all the time they said, "Oh, I create a good quality of mock-up, but after this, I could not finish." The patient complain a lot. That's why I stay showing every step.
And I think this is the main reason why the workshop makes all the difference in the world, because having the live demonstration and see the participants seeing you, how you are doing it on a live person over there, makes it much more clear.
Sorry for the time, and my English is like a boring.
Yes, not a problem. Looking forward. I'm just wanting to go to the presentation of the workshop, and afterwards to see what questions people have in the chat. Can we have just 1 or 2 minutes in order to close the presentation and afterwards to move forward?
Okay. And then this is the final situation of case. Okay. And this is normal position of teeth, and then she's forced lip, just for see all the balanced situation. Okay.
Beautiful.
And then just for show, this is like a open and wide, and then
beautiful.
We can finish right now, yes. But another thing, just for show this situation, because I put for example, we learn about the bone, okay, the bone biotype. The bone biotype means laminate, because this is like a very small and thinner bone. But the normal patient has 3 types or 5 types of just maxillary, okay, of bone. Biotype means laminate bone, and then prominent and laminate bone, and prominent bone. Okay, this is, and then we have interceptal and the palatal, and then you have 5 types of bone. But we learn like that. We learn like that. All this is laminate bone. This is not correct. That's why it's so important, because every patient is different. Because, and then you can see here is very, very like a thicker bone, but when you see here, it's not thicker, it's normal. But when you put open flap, I want to take off this, like because all the technique of periodont treatment is to take off this, because this is like a osteotosis, and then they I learn, I practice that. I don't know how many people take off all this bone, and then when I take from using burrs, like a spherical bone burrs, and then took off this, and then when you go under this bone, you have medullary cells. Medullary cells cannot stay in touch with another type of cells, like a periosteum. If they touch in the periosteum go more fast than cortical. Cortical, they need to expect for 4 months to create again the cortical. But in this period, they go to inside the periosteum, go to inside the medulla, create gap, like a create the fingers, and inflammation. That's why we have to use digital, just because every patient is different. I have to understand the patient is personalized. You have to personalize our job.
Of course. Very in-depth webinar and very in-depth lessons, Mr. Cano. I wouldn't say this was a free webinar if I didn't know that. And thank you very much for going into so many details and bringing this theory about the magic makeup, about the clones method in front of us with so many examples. What I think makes all the difference in the world is when people, medical doctors, stomatologists, really practice all this knowledge that you have showed to us. And in order for that, I would like to ask you one simple question. Yes. And I see that there are also I would like to ask everybody one simple question. I see that people are going with the questions in the chat. What is the most important idea so far? I would like to everybody to say one thing that they have taken until this moment from the webinar, And if you would sum up, Mr. Cano, the whole webinar into one phrase,
Yeah.
what would that be? And afterwards, I think we have to make the invitation for your workshop in Romania, because
Okay.
I'm guessing a lot of people are eager to hear that. And you have a very good offer tonight.
Mhm.
So what would be the sum up of the webinar?
I can say that you can learn from the book many things, from the article, everything, but this is like a segmented learn. But when you go to one course that we can following every step, I think you can learn more faster.
Great. And we will do that. So I see Alexander already asked us about the course. Alexander, if you can hold up your question a little bit, because I'm sure Mr. Cano will ask you, but I'll have to make the presentation at the beginning so everybody will know about the workshop. What if we would spend 3, 5, or even 8 days together working directly with Paolo Cano and diving deep into modern digital prosthetics? Do you think joining 1 or even 2 workshops would support your growth and your career in a competitive by-the-day market? Please, can you, if you have your answer in mind, if you can put it in the chat, would be great to do so. And starting with this question, we are inviting you to the 2 workshops that we'll be hosting in Romania, the Clones and Magic Makeup, Dental Prosthetics workshops with Master Paolo Cano. These are offline courses that help you refine your technique, gain in-depth understanding of modern digital prosthetics as you gained tonight, and achieve results that strengthen your status as an expert. These workshops are designed for prosthodontists and dental technicians who want to enhance their skills under the guidance of a world-class mentor. So, the Advanced Dental Prosthetics Workshops with Paolo Cano are 2 workshops, 2 courses with one goal: natural results, predictability in your operations, and aesthetic perfection. As you've seen tonight, you've seen examples that go to perfection. First workshop is the Advanced Dental Aesthetics, the Magic Makeup, is from 12 to 14 February 2026. What you will learn natural transition pigmentation techniques, 3D texturing, creating microanatomy details, integrating color layers according to the patient's age and type. As Mr. Cano said, they are personalized to the patient, glazing and polishing for a lifelike effect, and how to achieve the same light behavior on ceramics as on natural tooth structures. It has theory, because you need to understand the method, but more important, has a lot of practice and demonstration. You can practice yourself, and you'll be the method will be demonstrated by Mr. Cano and the 2 technicians that will come with him in Romania. Also, you'll have mild or injected veneers in order to make the process yourself from the beginning till the end. It's from 12 to 14. It's at Pasindora Clinic in Romania at Râmnicu Vâlcea, 3 intensive days with applied theory and practice. We have only 20 places available, and you can also pay in full, or it's available in 3 installments until February or 10th of February. The investment in Magic Makeup with Master Paolo Cano is, before I say that, please think for a moment, what would be the investment in order to go to Brazil to do the same workshop, as Dana did, because she did so. And that's the reason why we have this webinar and workshop in Romania. The travel expenses, all the preparation to go to another continent, not another country as we are in Europe if you are outside of Romania, or another city if you are in Romania. The investment is way, way bigger. That's why it's a very good investment to do that. So as it is in Romania, the investment for the magic makeup is only 3,600 euros plus VAT per participant. This is the first workshop. I would like to ask you one thing, Mr. Cano. What is the most important thing, if you can sum up this workshop into one thing, what the most important thing, what is the most important thing of this workshop? And again, who is it for?
This is, for example, if you're planning everything, like alignment, choose one morphology for the patient, they accept, and then you destroy everything because you want to create like a layer technique. And then that's why many people using technology, they prefer doing just staining technique, because you did everything, mock up everything, the patient accept everything, and then you just will create the feature or characterization of edge, of color, and then that's it. And the patient will accept, you will be happy, and you as well, as technician, as dentist, everything, I think, we feel like you that the life is more like more easy, né? More happy. I think change a lot our life. I think for me, because of this, I feel like everywhere I would go. When I go, they ask me about this, about staining technique. They want to do this. They prefer more do like this because they feel so easy to do. They feel more comfortable than very stressed when you go to layer technique. I did layer technique before. I love layer technique, but if you compare with our life right now, is different.
I see. Alexander, I see asked two very important questions. And before we get to the next workshop, the clones method, I would like to respond to Alexander's questions. He asked, is the first workshop for dental technicians or for dentists?
This is for both. Some dentists want to do for himself, and then everything. They want to do one crown, single crown, or one veneer, and then they want to do everything, because some people have all the set, the clinical and lab step, and then like a chair side solution, and then they want to do everything from himself. And then this dentist is very important to do this course. And another is technician, and technician is always working with this.
Perfect. And also Alexander asked, does the upcoming course in Romania and the other one also cover all the things from the course in Brazil? Will we learn exactly the same, and is there a difference? And if there is a difference, what is it? Looks like Alexander is a very well-known participant, because probably he also studied your course in Brazil.
Alexander from Romania?
I don't know from where he is.
The Alex? Yeah.
Okay, so the course in Romania is the same.
In Brazil is the same because it's the same, completely same. Yeah.
Perfect. So you won't be losing anything, Alexander, coming to Romania and having the same experience as you would have in Brazil. Great. So this is the first workshop, the magic makeup. But the second one is probably even more interesting, because the second one is about the clones method. is from 16th to 20th of February 2026. It's an intensive workshop focused on advanced aesthetic restoration, where you will integrate into a single protocol digital planning, mock-up and preparation guide, flapless procedures, minimally invasive preparations, precise occlusal adjustments, predictable cementation, and functional and naturally aesthetic finishing. The clones method has one thing that makes it unique, and this workshop makes it unique: live patient demonstration. You will have a live patient where on which Mr. Paolo Cano will show you the digital dentistry, both with theory and photo and video, the image creation, the surgical guide, gingivectomy, flapless procedures with theory and live patient demonstration, tooth preparation with theory and live demonstration, and aesthetic veneers with theory and live demonstration. It's not a YouTube, it's not AI, it's live demonstration where you get the skills, you get the method, you get the confidence that you can do it yourself afterwards. That's what makes it unique. It's from 16th to 20th of February. It's at Pasindora Clinic, 5 days with applied theory and patient-based practice performed by the inventor of the method, not by someone who learned from him, but by inventor of the method. We have only 20 places, and I don't know exactly the number, but I'm pretty sure that there are a few that are already occupied. So if you want to reserve your seat, it would be great to do it tonight. Also, it's available in 3 installments until 10th of February. 6 unique benefits for attending this workshop. First of all, you do not need to travel to Brazil. It's in Romania. It's lots cheaper in terms of travel expenses. You will handle in the entire case from the first consultation to the final restoration with all of this you see here written on my screen. I will not read it all because my dental English needs improvement, but you can see it here and you also can see it on our page. The full hands-on practice of the entire process on a real patient performed by Mr. Paolo Cano, a turnkey solution with immediate applicability of the method that you can use right after you finish the workshop, 5 days of intensive theoretical and practical training, immediate applicability, and Mr. Cano will be joined by 2 technicians. So he will not travel alone from Brazil. He will travel with 2 technicians to demonstrate the importance of the collaboration and the role of each specialist plays in achieving a complete treatment. You can find all these details on our page. The investment of the clones method for the 5 days is just 5,900 euros plus VAT per participant. And as I said, we have you can also pay in installments. But the most important part, as you may know in Apple's keynotes, one more thing. There's one more important thing. We have a limited time offer because you participated in this webinar, you showed your interest, you dedicated almost 2 hours now in order to understand the method, to get the information, to get the knowledge. You will also have a 10% discount valid for 72 hours. What this means? Basically means if you purchase either of the 2 workshops or the 2 together, it's applied to participants who registered tonight, and it's valid only for full payment. So basically, if you want to participate at the clones workshop and you are really dedicated to it, if you pay until 12th of December, you will have 10% discount, which basically means 5,450 euros plus VAT. So it's a big opportunity and big benefit in terms of the financial investment in order to do it so. If you want to participate at this workshop, for sure, this is the moment to do it. And this is valid only until of 12th of December 23:59. Yeah, great. So how you can do that? I'll let the offer here. I started the offer. As you can see, you can have the offer in the chat. Also, I'll let the link in order to be even easier for you. Just sharing the screen one more time. If you joined that link, I'll let in the chat. You will be taken here, where you can also see beautiful video with Mr. Cano and images from Pacintora Clinic from Romania. All the details I have already told you. And also you will have here the details that you need to complete in order to register for the workshop. This is the Romanian page. You can also have the English page, as easy as you have seen on me. If you have questions, it may be maybe there are some questions regarding the transportation, the accommodation, the anything, any type of question. I will let the number, the phone number or the WhatsApp number of Mihaela. You can ask Mihaela at this number anything you have in mind, and she will gladly respond to your questions, even if it's about maybe you want to come with 3 dentists from your clinic or 4, or you want to come with someone else. Mihaela will be available for you in order to respond to any question you may have. So I see that we have some questions. Helen, I would like to join the clones course, but I cannot make it in February. Will there be other possibility next year? I think you know it better, Dana, than I do.
After we talk with Master Paulo Cano, we decide if the next year we have another course.
Yeah. So they're not scheduled at this moment, Helen. If you can make your schedule a little bit different in order to participate for this time, would be great. If you can mute yourself for a moment, Dana, because oh, perfect. Great. So this is the answer for the moment, Helen. I saw Maria ask the question that is more technical. How do you approach patients who have TMG disorders? And how do you monitor the condition of the TMG after full arch prosthetic rehabilitation? You are on mute, Mr. Cano.
Okay. Full mouth rehabilitation is a little bit complex because we need to understand which problem the patient has, because it's not just one situation. It's many kinds of situation we had, and then for just answer one solution is not so good, because included treatment, I need to see the condition of or the problem the patient has, the age, the problem of missing tooth, or just because of TMJ problem, because the patient they cannot open mouth, and we need to understand very well the problem. But if I do, because she said, she asked about after treatment. But I can say after is difficult. That's why it's very important diagnosis. After is like a if you try to do, for example, partially, for example, some protocol, partially treatment, okay? You don't know what is more, biting more, and then another is not so like a not forced or something like this. Is different level of tooth. Another thing is all tooth has owner intrusion. That's a problem for the adjustment. That's we have 5 days demonstration or 5 days course in the Dana's course, because she understood that the occlusion is very important for understand. But one thing about occlusion is for finish the case. This means occlusion adjustment. If you do orthodont treatment, you have to do occlusion adjustment. If you do perio, if you do one crown or restoration or restorative operative restoration, you have to understand the adjustment, and then you have to for me, when I start my job in the full mouth rehabilitation, I took my time for planning. I take more my effort to understand very well which problem the patient has, and then I do the tests. I do the provisional before. I prefer when the patient stay like very, very comfortable with TMJ, and then I start my job for the preparation, for everything like that. Because when I finish the cases, I don't know why. Because I have measurement, I do the measurement for the video, because you stay when you see you stay say talk about the full mouth rehabilitation, you do the video. Orthodontists do the video, and then everything you have to understand before, because after is very difficult. Okay, for me this is I cannot answer better than this, because always is different, include the protocol for treat patient. Oh, the sound.
Paul, nu te auzi.
Yeah.
Yeah.
Thank you very much for your answer, Mr. Cano. We will be waiting your answers in the chat, your questions in the chat. Yes. Until that, I'll just answer to 5 more questions. These are the questions that my colleagues usually have from the people that are interested to Paulo Cano's workshop. First of all, where will the workshop take place? It will take place at Pasindora Clinic on Alea Castanilor number 31 in Râmnicu Vâlcea, Romania. The road from Bucharest, the capital city, till Râmnicu Vâlcea, it's 2 hours and a half, 3 hours, something like this. If you are in Romania, you already know it's a very easy to go place. What is the daily schedule of the course? The course will take place every day in an intensive format, starting at 9 o'clock with breaks for coffee, breakfast, lunch, and dinner. Please correct me if I'm wrong, Dana. All the meals are included in the price.
And party.
And the party is included in the party. Okay, I missed that, but I didn't miss the meals. Usually for a man, the meals are one of the most important. So you will have all the meals included in the investment that you'll take. Mr. Paulo Cano is, as you've seen tonight, I don't have to say it again, is very committed to sharing as much knowledge as possible. So the schedule may be extended, probably not the day with the party, but the other days may be extended to ensure all essential information is fully covered. What is the difference between this workshop and other digital prosthetic courses? As you've seen, this workshop stands out from other courses because it's offered direct training from the creator of the clones, Mr. Paolo Cano, and includes full demonstration on a real patient. Knowledge, you may find it anywhere. Maybe not the same kind of knowledge, but you can find knowledge. But demonstration, practice, feedback from the creator of the method, that's what you can't find anywhere. And you'll learn the entire protocol from the first consultation to the final restoration, including exclusive techniques such as magic makeup, 3D, and flapless procedures for crowns. And Mr. Cano is joined by two highly experienced technicians from Brazil who will demonstrate and explain the techniques in detail. So you'll have the full understanding of the process from start to finish. Do you need to have already experience with CAD and CAM in order to participate? The workshop is structured to be accessible to all prosthodontists, regardless of your level of digital experience. So you'll learn step by step all the stages from scanning and digital planning to clinical implementation. And will you have the opportunity to discuss your own cases individually with Mr. Cano? And the answer is yes. The workshop includes dedicated sessions for questions and discussions, and you'll have the opportunity to ask specific questions and have your case discussed and have feedbacks and practical sessions. So Mr. Cano will be available for one-to-one consultations related to your specific cases. As I said before, if you have any questions, you can reach my colleague Michaela at phone or WhatsApp. You can contact us at email, or if you do not have any questions and you liked what we have presented tonight, and also you liked the offer, you can just enter on the website and register yourself right now. I broadcasted once again the link in order to enter on the website. The offer, you have it already here. So I don't see any other questions coming to the chat. If there are people who have any other questions, we are glad to have them. I see we have 2 minutes. We'll be on time. If you have a final message, Mr. Cano, we are more than glad to hear it.
Well, I would like to say thank you so much for this opportunity to do this webinar, and I want to see everybody in the Romania, in Vocea, in Romania.
Hope as much as possible from the people that joined tonight will also be in the workshops at Pasindora. Dana, you are the organizer. You are the main link for everything that happened tonight. I will let the final word to you.
When I was in Brazil, I know the master is the mentor for me, and it was an opportunity for Romania and for Pasindora Clinic and for me to learn more information about dentistry from Master Paolo Cano. In Pasindora Clinic is a experience, not about what we learn. It's about experience with more information and activity, and I can expect to come here in February. It's a 3 A treia oară, Paul.
Third time.
Yes. And thank you very much.
Thank you, Dana, for making all this possible. So everybody that wants an extraordinary experience, a method that will remain with you for probably the whole career, I recommend you to join the Pasindora workshop with Mr. Paolo Cano. It will be a memorable experience and probably your best investment for 2026. Thank you very much, everybody. It's such a pleasure to be here. Thank you, Mr. Cano. Thank you,
Thank
Dana.
you.
And
Thank you so much.
looking forward for the workshop in February next year.
Thank you. Thank you so much. Thank you, everyone.
Thank you.
We're here.
We will be needing you to just go push the button, Mr. Cano.
Yeah. Here. Okay.